What's going on, everybody? Gaming Diva is here, and I'm currently on my way to a dumpster to throw out some trash. But just to follow up from my last video that I did, talking about, without giving too much, because for me, it's still a process in getting used to the new normal of caretaking for your loved ones and going through the whole process of trying to help an adult who's never got their proper diagnosis as a child. And I just kind of wanted to share a little bit of that journey for people who may also be caretaking, who may also be going through the same things that I'm going through or dealing with, and might need a little bit of advice, guidance, or how to continue to just live life and press forward. But also, while at the same token also taking care of your own health as well. Life be lifing, and there's very few of us who, growing up, that they'll retain the same, body shape. As we get older, some of us, we stay skinny. Some of us build muscle. And as you can see with me, I've gotten a whole lot voluptuous. And now I've always considered myself to be a pretty decent person in terms of taking care of their mental health as well as their physical health, even in the midst of me gaining all of this lovely voluptuousness, this thickness, right? But after taking care of my mom, visiting my dad at the long-term hospital that they got him at currently, it really, 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 really put things in perspective and open your minds up to wanting to really take your health more seriously, especially for me. Now, I'm in a situation right now where I'm currently caretaking for my mother, trying to help my dad out to the best of my ability with the limited resources that I have, as well as helping my uncle, while also maintaining my own household. So for me, I have to make sure that I take mental and physical breaks, meaning, now this is the part that might be a little bit hard for people to talk about, because nobody wants to seem like, oh, I don't love my loved ones. Now, we're going to talk about it. It's going to get a little deep. So grab your tissue, sit down. So for the longest time, I felt a lot of resentment. I felt a lot of resentment towards my loved ones, because in my head, I'm like, how do you allow yourself to get to this point, right? Which led to, I guess, all these other different types of emotions. So for me, I had to think about it. I had to really sit down and really just check myself with that, because I was feeling a lot of resentment and anger, disappointment, scared. I felt all of those emotions. And then I kind of had to check that, because it's like, you don't know what people are going through. You really, really don't. unless you check in with them, you talk to them about it, to kind of gain some type of understanding as to, at least from their perspective, as to why things happen and why they are what they are. And then too, you just gotta understand, a lot of it is childhood traumas. A lot of it is, I guess, never getting a chance to say what you had to say. At least from talking with my different family members. And a lot of it is mental health. Depression is a mug. On top of going through that next stage in your life as an older adult, as a woman and as a male. You know, women, when we get older, we start to go through perimenopause and things of that nature. As a man, it's different from men and women. They go through what they go through, right? So you got to kind of understand from their point of views, their perspectives. And yeah, so I was dealing with that. And excuse me if I'm jumping around from point to point, but I think I might have a little tad of ADHD. But going back, what I was saying, as far as me making sure, I have to make sure that my health is on point, because at any given time, if I'm sick, not feeling good, or I'm down and out, and I'm checked out mentally, I can't help my mom, I can't help my dad, I can't help my uncle, I can't help my husband, I can't help my own child if I myself is going through what I'm going through, or if I'm sick. I can't help anybody. So me, I've already been very conscientious of my health, or at least try to be. There are a lot of areas in which I could work on and improve on, which is, you know, laying off the ultra processed foods that we get from the middle of the grocery store. That is also, you know, finding healthier alternative choices. That is also making sure that I prioritize my mental as well as my physical, so I can be physically and emotionally tuned in whether I'm caretaking for my mom, where I'm trying to, you know, be there for my dad, while I'm also trying to help my uncle. Gotta be, because if you're the only person that they're leaning on, and you're not able-bodied to do the things that you need to do, you can't help them. Right? And I've had my fair share of dealing with doctors, nurses, people not doing their jobs, making a lot of skilled nursing facilities look bad. Yeah, I've had my fair share of that. Trying to help my mom. I want to say when was this? Last year, 2025. So I'm gonna share this too with you while you guys are with me on this beautiful sunny day. I'm trying to get out, be one with nature. You know, often I pray, talk to God, you know, just to kind of, this is how I reset myself. That, and been gaming. Even though I haven't been streaming, I'm just like, can't entertain. I don't want to fake the funk. I'm just trying to get myself back together so I can, you know, get back to content creation and streaming. But anyway, so skilled nursing facility, 2025. this was right around the time when my mom was constantly in and out of the hospital, because she's an older adult now. She's going through her what's called that next phase of womanhood, where she's experiencing perimenopause, and she had some type of skin condition, HS, on top of dealing with her own medical issues that she's dealing with. So when she fell that last time, she ended up in the hospital, and also, like, I think the left side of her ear is busted pretty bad. So when I talk to her now, I have to like speak and project my voice pretty loudly because she can't hear on one side of her face. So dealing with that, and it's hot out here. So dealing with all of that, they suggested, like, so after my mom was in the hospital. I think she was in there for like 2 weeks. She was in there for 2 weeks, and they decided, the caseworker decided to send her to a skilled nursing facility, which was supposed to have been helping her get back on her feet as far as occupational and physical therapy. But what happened was, now this is supposed to be a place. Now these facilities, right? I'm going to just preface this before explaining and telling y'all the ugliness of how some of these facilities are. And you really, really have to advocate and stay on these doctors and nurses' necks, unfortunately, because in your head you're thinking, well, if I'm paying out of pocket, if we're using insurance, you would think you wouldn't have to too much worry about your loved one, because the whole purpose of these facilities is that way they can have a place to live and be at, because you don't have the tools or resources to take care of them either at your house, because maybe you don't have the medical supplies or equipment, or maybe you don't have the room, like whatever the case may be. Or some of us, we just can't mentally or physically deal with taking care of a loved one, which I get that side too. Like, I know some of y'all might think that's messed up, but think about it. Let's just really think about that for a minute. If you're used to seeing your loved one in their, all your life, seeing them be very energetic, being, cooking, cleaning, spending time going outside, touching grass, all that good stuff, and then one day they're bedbound or dealing with mental health problems, being depressed for over 20 plus years, and dealing and coping with the fact that your parents are gone. Like, mental health is a mug, and it's something that really plagues the Black community, because for us, we're taught to, some of us, I would say, we're taught to hold everything in. Oh, don't go talk to a shrink or a psychiatrist because you'll be crazy. Oh, therapy doesn't help. Talking to somebody don't help. Like, all they want is your money. Now, some of that and all of that can be true and false at the same time. That's why you got to really do your research and figure out what is going to be the best option and what's going to work for me. But anyway, I digress. So yeah, you're not used to seeing your loved ones like that, and that could stump you physically from being able to act and think logically. So me, I have no choice but to be there for my family members. Because, well, one, I don't mind taking care of my loved ones. And that's because my mom took care of me and my brother as a single parent, doing the best that she could. She had to. And I know some of y'all hate when people say this, but, you know, just figuratively saying, you know, my mom had to be both mom and dad. She had to give us enough love to carry between two parents. And that is such a true statement, because it's like your father, or supposed to be father, wasn't in your life, not giving you advice about men, boys, things of that nature. Mom had to work overtime, right? And she had to do it to the best of her ability, which we were in church at a young age. And how me and my brother, how we got our male influences, and, you know, was my grandfather when he was alive. He passed away when I was in high school, 2005, my senior year actually. So dealing with that, losing one of your only positive male role models, that hurt. And then I would say, this year, 2026, I lost another very important male father figure, which is whom I deemed as my guy grandfather. You know, lost him. He passed away. So, growing up in the church, my mom made sure that my brother and I were around good men. You know, but before that, just like anybody who don't know how to do certain things, everybody is trying their best with the knowledge and their know-how. But anyway, back to this skilled nursing facility, right? So my mom gets discharged from the hospital, and they send her to this place, which I'm quite sure is a good facility, but some of the people that they have working there are not there for what you're supposed to be. Like, okay, now feel me on this. I know when we go out and we look for jobs, a lot of us is looking for the best paying job possible. I get that. I get everybody has to make money, everybody has to make a living. But there are certain industries I feel like you do not need to be in. If you are, one, not a people person, if you're not into customer service, if you're not into sharing and being compassionate to the sick and the elderly, because you got to realize, and like I applaud you doctors and nurses and skilled caretakers and service providers who are doing your jobs. I tip my hat off to you because you're doing it right. Now you other MFers, because this is YouTube, you other MFers that's out there not doing your fucking jobs, not reading your patient's charts, giving them the wrong medication, or you're pissed off because the patient is complaining and this and that and the third. That's what you signed up for. That's your job. I'm not saying to take disrespect. I'm not saying, you know what I'm saying? But you're dealing with people that are sick and hurting. And one of the biggest things that I can tell you personally about my mother, because my mom used to work in a medical profession after she got out of college. She was a nurse. And my mom, although she probably would have been the perfect nurse if she would have stayed in that profession. Because my mom is the type of person, when she gets to know you and care for you, like my mom has a big heart. But also too, with that big heart, she couldn't set aside, she couldn't stand the fact of going into work one day and that patient that she built a relationship with, who might have not had any family, might have not had nobody to talk to while they're sick and they're probably on their last days of living here on this earth. It was too much for my mom when she would come back to work or the next day, you know, coming from her off day to find out that that person passed away. There, you know, she couldn't do that. So she went to her next calling, which is cake decoration, baking and doing her cakes. But anyway, and I get it. Not everybody can deal with that. I know I wouldn't be able to deal with that either, because I'm like my mom in a lot of ways. I care for people. I actually give a damn. And I know that would affect me, you know, losing a patient that I was like lone care helping, or, you know, just visiting as I'm doing my routes. Like, hey, didn't want nothing, just want to check up on you, good, you know? And then you come in one day, somebody that you built that rapport with, and, you know, just to make their day a little bit brighter, just to stop to say, hey, I see you, I love you, pray things are going to get better, right? I'm like that too. That's why I couldn't be in the medical profession, not in that dynamic. I would say now, if I chose to be in a profession, I would have to be literally the person coming in, you know, taking your blood pressure or something. I couldn't, like the technicians. I would have to be a technician, because being a nurse, I wouldn't be able to do that. Like every other day, I'll probably be crying. So, you know, but anyway, there are a lot of people that do not need to be in certain industries and certain job roles if you are not the type of person who have, one, the patience, because it takes a lot of patience to be a doctor or a nurse. And I get it. Not all your patients are good people. I get it. You guys, y'all work days, 12-hour, 14, 16, 20-hour shifts, because either somebody didn't come in or you're understaffed, and then you got to deal with a patient that's yelling and screaming at you, lack of sleep. I get it. But going back to my mom is the type of person who knows her body. She's in tune with her body. And also too, on top of that, for somebody who has previous experience in the medical field, if she's sitting here telling you, hey, don't prescribe me this medicine because I'm allergic to it, or I've had a bad reaction to it in the past, and then you as the doctor or nurse signs off on that shit anyway without pulling up a patient's chart or medical records to see, oh yeah, this person can't take this medicine because of X, Y, and Z. Now, I'm not a doctor or a nurse, but to me, in my head, that would be like common sense or nurse doctor, or being a nurse or a doctor 101. Even if this is a new patient in your hospital, read their fucking charts. This video is probably going to get demonetized. Well, I'm not monetized anyway right now, but replaying all of this and talking to you guys about it is making me mad all over again. But that's basic. Like, now, prime example, right? Now, the nurses are to assist the doctors, right? So even if, let's say, the doctor missed it, you as the nurse, you guys are the ones constantly, for the most part, y'all have the closest rapport with the patients. It's so much stuff that y'all got to keep up with. It's like, you didn't read her chart? That's how people get sued. That's why people die in hospitals, or people don't trust doctors and nurses. Because either one, you're inexperienced. Two, you don't know what the fuck you're doing. Three, you might not care, and that might just be a paycheck for you. But I had to literally, y'all, stay on these doctors and nurses' necks. And it was so ridiculous. A lot of them did not have the proper bedside manner. I'm like, that Hippocratical oath that they take, I'm like, the fuck is going on in here? It gets worse. So they wasn't reading my mom's charts. They were giving her medicine that, or too much of a certain medicine, because she had an infection when she was going through herpetitis. I can't pronounce that S word, but they call it HS for short. Y'all look it up. It's called HS, but it's like it's a skin condition, like flare-ups, like pus, blood can be coming out of the skin, really bad smell, whatever. So, not really sure what causes it. I'm quite sure I'll put something up here showing the definition or explaining what HS is. But she was dealing with that. That's what she went to the hospital for. It was that. It was when she fell for that last time, and she was going through HS. So they were giving her a bunch of antibiotics to, clear it up. But on top of that, she was trying to tell the doctor about her ear. Now, don't get me wrong. Even if you're a hospital that don't treat, or you're not specialized in that, it's one thing to say, oh, I can't help you with that. But then it's like, okay, if you can't help me, can I have some referrals to doctors who can help me with this that either you don't know how to do, or you can't or won't do. Just that simple. Or at least you would think it would be that simple. So she's dealing with that. Then next thing, my mom has she takes blood pressure medicine, right? Bad heart. So while she's in the skilled nursing facility, the next big red flag was the food. I had to literally almost every single day or every other day either fix my mom her own food and have it delivered there, or I would have to go grocery shopping for her to put it in her room. Because it's like, there's a lot of elderly people here. One. Number two, why is there so much salt in the food? Now, I'm a type of person, I love a lot of flavor. But for me to taste it, for me to taste my mom's food, and I was like, this is not, like, imagine you bite off into some mashed potatoes, or you find out your favorite dish is on the menu that day, and you bite into that, what you think is going to be delicious, nutritious food, that's going to nurse you back to health. Imagine you take a bite and you're literally eating salt. So I'm calling the head nurse at this point. I'm calling the head nurse. Well, no, number one, hold on. Let me back up a bit. I'm going to come back to that. Upon entering this facility, I already knew I was going to have to stay on their necks. Because as soon as me and my husband walked in, I didn't know what room my mom was in. So I'm at the front desk. There's two little goofy bibbity bobbities, and they're standing there having a full-blown conversation like they at work. And I'm just standing there. I'm not interrupting them because, one, I'm not rude. Two, I'm standing there for at least a good 20 minutes. No exaggeration. I'm standing there at least a good 20 minutes. And then I see a young lady off to the side that's on the phone. Once I saw she got off the phone dealing with whatever medical matter she was dealing with, another patient, I guess, talking to the pharmacy. Man, I go over to her as soon as she gets off the phone because she made eye contact with me. The two ladies that's right in front of me, they see me. I'm looking dead at them, and they're steady carrying on a full-blown conversation that was very inappropriate for work, by the way. Now, don't get me wrong. I'm not saying that you can't chit-chat with your medical professionals. But for me, that's always worked in the industry of customer service. You know, whether it had been GameStop, Target, Walmart. Yeah, you chopping up with your friends, you know, whatever. But then it's like when you see customers that are around you, you stop and you be like, hey, how can I help you? You know what I'm saying? They just steady just talking. And I'm standing there, I'm dead in their face like this. Like as close as I can get to them. And I'm quite sure I had a certain expression on my face. Because I'm looking at them like I can't hide my facial expressions. I told my husband and my mom, I'm like, I would be horrible at poker. Because my face will give it away. But anyway, they just steady talking. And I'm like, so once I saw a baby girl literally 5 feet away from them, she had her back turned. She was on the phone, but I could hear her conversation. So she was on the phone with pharmacy trying to put in a prescription for, you know, a client, an outpatient that's going home. Anyway, as soon as she gets off the phone and she spins around, she made eye contact with me. And I went over to her and I was like, ma'am, can you help me? And as soon as I looked at her and said, ma'am, can you help me? The two goofy ass ladies that I was standing right in front of for 20 minutes, who made eye contact with me, who never acknowledged me, then had the audacity to say, oh, you needed help? Duh. So I'm talking to her. I'm like, yes. And I looked at them. I said, no, I don't need your help. I literally told them, I said, you had 20 minutes to help me. I said, no, I don't need your help. So I looked at baby girl. She was like, yes, ma'am. What can I help you with? And I said, I'm looking for such and such. It's the first time here. She got checked in yesterday. You know, what's my mom's room number? And she was like, oh, let me look that up. Okay, she's that corridor, da-da-da. So that was my first bad impression of the place. And I'm just like, oh, hell, here we go. Now I got to deal with this. Next thing was, they wasn't giving my mom her medicine on time. Because when you're in a skilled nursing facility, they tell you whatever over-the-counter medicines that you take, not to take them, because they're pulling up from your primary doctor list of medications that you take. So they're the ones that's administering their medicine. Now, my mom currently still being of sound mind and body. She has her own little blood pressure cuff, and she takes her blood pressure. Like, she keeps track of that. She even has an alarm letting her know, hey, it's time to take your medicine. And she takes it like twice a day. So my mom, one night, it's going on midnight. I'm in the bed already asleep because it's still during school time, and I'm on my son's schedule. I'm asleep. My mom is ringing me off the hook. I answer. I'm half woke, half asleep. My mom is crying. She's like, I'm in pain. They haven't given me my pain medicine. They haven't given me my blood pressure medicine. So she's freaking out. On top of that, nobody had came and changed her for like 2 or 3 hours. So imagine what my mom is going through. A person who is independent, who used to doing things on her own and for herself, and she's left at the mercy of people who don't care, don't want to work, or is in, like I said, the wrong profession. She called me crying, and at first I couldn't understand what she said. She's like, they won't give me my medicine. I've been sitting in my own feces and urine for 2 hours. Nobody came in here to change me. Da, 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 da. And I'm like, what? So, unfortunately, I'm like, all right, mama. I hang up with my mom. I called the front desk. I called the nurses station. I'm pissed because, one, you know how us black folks are, or just people in general. When we sleep and we wake up to some BS, like, I'm pissed. I called the front desk. I was like, hey, are you the head nurse for overnight? She's like, yes, ma'am, I am. I'm like, ma'am, my mom has been calling for a nurse for hours now. Because I remember, and it's not a lie, because a lot of times when my mom will be in the hospital or wherever she's at, half of the day I'm on the phone with my mother. She's on FaceTime with me. So I'm seeing her nurses that come treat her in the mornings. I'm seeing the nurses that come in the afternoon. And I'm seeing the nurses that she's attending to her at night. Right? I'm seeing all of this. So right before I went to bed, this is like 9 o'clock at night, 10 o'clock at night. And I remember, because she was supposed to get her medicine around about that time. They still hadn't given my mom her medicine yet, her blood pressure medicine. Something that could literally cause a heart attack or a stroke if your levels get too high. 2-3 hours later, they still have not given her medicine. I'm like, what is going on? Right? Now to play Angel's advocate, I'm like, they must be short-staffed. But even then, even if you're short-staffed, you would think, or at least me, I would think as a nurse, I'm like, hold on. let me go make my rounds real quick and give all my patients their pain meds and whatever other medications they're taking first. And then I'm gonna go back around and make my rounds to clean, bathe, change sheets if need be, whatever. But I guarantee you that's probably what happened. With them being understaffed and some of the nurses, and it wasn't all the, so let me preface this and say it wasn't every single nurse or doctor there. Because there were some really good nurses or doctors that made sure that my mom was taken care of to where my mom didn't even have to buzz for them at night. But those first 2-3 weeks of her being there, out of the month that she was there, before they discharged her and sent her home, she was going through it with these folks. That left a very bad impression on her, because now when I try to be like, okay, well, now this is something that we also that's not talked about. When you have a parent that is still of sound mind and body, when you have parents that has gone through a traumatizing experience like what my mom went through at that last skilled nursing facility, now she has in her head, nah, I'd rather be at home. I'd rather have a doctor, nurse come out to me to my house. I don't want to be in that environment, which I get. But at the same token, I'm trying to be nice, compassionate, but also I'm trying to tell my mom, I'm like, hey, I get it, but if X, Y, and Z don't pan out, I got to schedule you transportation so you can go to these facilities so you can get X, Y, and Z. So I was getting a lot of pushback. Like, I was getting a lot of pushback with my mom from that. And I think at the time, she thought that I didn't understand where she was coming from or how she was feeling with it, which I understand. But at the same token, I don't think she was understanding where I was coming from with it, which is, hey, baby girl, I'm trying to see what all is going on with you, so that way I know best how to help you. So this is something that I don't think a lot of people talk about either, is that pushback that you might get sometime from your loved one who is, not going through dementia, not going through any of that. They're still sound mind and body that can still make their own decisions. And it's just like, so I went through a lot of that, which added on to my resentment. And I'm just like, so this is how my logical brain was working at the time. Because remember, my mom's side, she just experienced something very traumatic. Right? So now she don't trust a lot of these skilled nursing facilities because of a handful of doctors and nurses who didn't want to do their jobs or didn't care, or just maybe they were contractors. Now how I know this, that place was so understaffed, and I would pop up on them. So all my caretakers out there, people that's at, like, we as the people who are trying to do what's in the best interest of our loved one, we have to be the ones to advocate for your person that you're taking care of, that's either in these hospitals. It's just not the skilled nursing facilities, the hospitals too. Because a lot of them, they'll go in there and like they'll look at somebody like my mom, who is a heavy set woman, very voluptuous, but she's always been heavy set and voluptuous, right? a lot of them would come in there and right off the bat would profile my mom and automatically assume that she has diabetes. And my mom is like, I don't have diabetes. She doesn't. For my mom to be the weight that she is right now, a lot of people would assume, oh, you're a big woman, you heavy set, you have diabetes. And she's like, no, I do not have diabetes. Never had a history of it. Never had it. Because even for my mom to be a big woman, she takes care of herself. She eats her fruits and vegetables. She watches her salt intake. Like all the things that would probably, give her a heart attack or a stroke. She don't divulge. But also too, because of it, she's lost a lot of weight. And so a lot of the doctors would look at my mom with disgust. And in my head, I'm like, get this doctor up out of here. Where's the caseworker? We're putting in a formal complaint. Because you gotta think about it like this too. Now, imagine. Now, this is somebody coming from somebody who can still talk, articulate, and let these doctors and nurses know, hey, no, I'm not supposed to be taking that. I'm supposed to be taking this because I'm allergic to this. Now, imagine you have a grandparent or a loved one who might be recovering from a stroke, recovering from a coma, has a trach in their neck, or some type of surgery, some type of deficiency that's causing them not to speak. Imagine you have somebody in the hospital or that skilled nursing facility and they can't speak up, they can't talk. You, as the loved one, you have to be the advocate. You have to stay on these doctors and nurses' necks. And if necessary, get them the fuck out of that hospital, because guess what? What happened to my mom could happen to your mom. It could happen to your grandmother, grandfather, uncle, child. I'm like, get them up out the game, coach. Man, when I tell you, I put in so many complaints in 2005, 2006. Bro, you have to stay on their ass. Because if you don't, it could literally mean a life or death situation for your loved one. It could literally mean that. Because even for myself, when I was in the hospital, I was 2 months? Yeah. I was 2 months pregnant with my son. I was 2 months pregnant with DJ. And they were trying to figure out what was going on with my liver. And why I was throwing up so much. Like I had the rare, I can never pronounce this word either. But if you look it up and Google it, it's the 2% rarest condition that women get when they're going through morning sickness. I had that, which I was in the hospital for, and they couldn't understand why I couldn't keep food or water down. I'm in this hospital for a month. Now, so if y'all know anything about these hospitals, if they can't right away diagnose you with anything that looks familiar, what they gonna do? They're gonna be running round the clock blood tests. So for me, who already don't like needles and is needle phobia, 3 times a day, they were getting 5 to 6 vials of blood from me. In the morning, before I eat breakfast, And I'm talking 6, 7 o'clock in the morning. Afternoon, before I ate lunch, and at night. And what they had to do, they were sending it off to whatever facility to get the results. Because they were testing me for autoimmune diseases. Because it wasn't just the fact that I had morning sickness. It was something going on with my liver. I had like fatty liver. And they were like, and it was that, and it was my count. I don't know if it was my white blood cell. It was something that was off, and they were trying to figure out what it is. So anyway, eventually it got to the point to where, and now the hospital too that I was in, nice hospital out there in Richardson. I was all the way out in Richardson. But the downside to it, it was also a training hospital. So no shade or nothing to our up and coming medical professionals of the world. But I had a trainee drawing my blood. And for somebody who has a needle phobia, and now I tell this to every single doctor, every single nurse, whether it's my primary doctor or I'm going to like urgent care or CVS, I give them that disclaimer. I tell them, I'm said, hey, I'm needle phobic, very scared of needles, had a very bad experience with it as a child that lingered with me as an adult. I hate getting shots. I hate it. I hate getting my blood drawn. Hate it with a passion. Now, to a lot of y'all, that might seem silly, but it's bad. I got it real bad. Anxiety levels, they shoot up through the roof to the point to where by the time they do capture my vein and things of that nature, no blood is coming out because my anxiety is so up there. There's no blood coming out. So over the years, I've gotten a little bit better. So I literally have to psych myself out. I'll still tell the doctors, nurses about it, give them a disclaimer. I told them, I said, hey, I'm not going to jump. I'm not going to react. But how I get through it, just in case somebody else is going through the same things I'm going through, I tell them, I say, hey, just talk to me, distract me. Let's tell me what, I'll just have a normal conversation with them. And then I also tell them, since I have small rolling veins, I tell them, I said, hey, you're going to have to use it's a needle that they use for babies and toddlers. So when your veins are so small and they can't find it, or if it's not a trained doctor or professional who can't get it that first or second time, they have to use the butterfly needle to draw my blood. I know. And then sometimes I tell them, just so I can get it over with, sometimes I tell them, I said, just draw it from my hand, because you see this big ass vein that's in the middle of my hand, which is, by the way, the most painful place for them to stick any type of needle or IV. But because I just want to get over and done with, I tell them, stick me in my hand. Whew. So when I was in the hospital, I had a trainee who still learning. Like I said, no shade, no salt to the individual learning, because they have to learn. I get that. But I didn't want nobody practicing on me who didn't know what the heck they doing. So my brother, my other brother, Broderick, and my mom was in the room present while this is going on too, by the way. And I'm glad they were there, because even in the midst of me being of sound mind and body, because of my phobia, because of the pain I was feeling of her constantly poking the needle in my arm and digging, trying to find my vein, like that, like I was stuck. I couldn't say anything. I'm like, ow, obviously I was saying, this doesn't feel good. I'm in pain, but whew. All right, y'all, we're gonna go back in the house. Got my little walking workout in for the day. Whew, it is hot. Even though sun ain't even all the way out, it is hot and humid where I'm at. We're gonna go back in the house. So, anyway. Whew. Hold on, y'all. So, and then too, my body is telling me to stop. When you're working out and you're building yourself back up to where you used to be, always listen to your body. Because right now I feel faint and slightly lightheaded, and that's just from walking. But also the humidity and the heat that I'm feeling right now. Whew. Oh, it's telling me to go in the house. Hold on a second. I'll be right back, y'all. I need to take a break.